Hello everyone, this is Dr. Chhaya Makhija, a board-certified endocrinologist and lifestyle medicine specialist, and today we are going to talk about a very common topic which is misunderstood, and that is thyroid nodules. So what are they? What should you do about them? When to seek the right medical expertise? We are going to dive into the details to alleviate your anxiety. Now, don't be surprised that thyroid nodules are extremely common, and almost 50% of us as humans will have them after the age of 60. Now, most of the times, these nodules are asymptomatic, or you may not feel them, neither your clinician may feel them. But if they are getting larger, or if your clinician is able to feel them, then you would need further evaluation. What is important to know that most of the thyroid nodules are benign, that is, they're not cancerous. So what do we do if your clinician feels an abnormal thyroid lump, or you feel an abnormal thyroid lump or a thyroid lump, or if you are getting an imaging and the radiologist discovers an incidental thyroid nodule? Can thyroid nodules cause symptoms? Most of the thyroid nodules will be asymptomatic, but if they're large, or if they're located behind the thyroid gland, or if they're enlarging, or even if they're waterable pockets, or very seldom if there's bleeding in the thyroid nodule, then they can cause symptoms. Symptoms like difficulty in swallowing, or change in voice, hoarseness, or it may be an obvious appearance in the front of your neck where someone or you may notice a thyroid lump. If you are noticing a neck lump, which is in the thyroid region or in the neck region, then the next best step is to consult with your physician so that further evaluation can be undertaken. So how do we as endocrinologists manage thyroid nodules? Now, if you are a patient and have noticed an abnormal lump in your neck, then the first step is a bedside thyroid ultrasound. If a clinician or an endocrinologist is not able to perform a bedside thyroid ultrasound, then the patient is usually referred for an ultrasound of the thyroid. It is very important to get that as your first step. And then if you've never had a thyroid function test, that is a blood test, then that would be also a good thing to accomplish. If a thyroid nodule looks suspicious on ultrasound, there are various characteristics that we look at. There could be a cyst, which is waterfall pocket. There could be a mixed cystic solid nodule, which could be partially filled with water and partially solid. There could be complete solid nodule, and there are variations in solid nodule. Now, there are other characteristics that we as endocrinologists or even your radiologist will take a look at, and these are basically specifics on the ultrasound, which are ultrasound characteristics like calcification, or any calcium specks, or are there any changes in the blood supply, that is the vascularity of the thyroid nodule, or it could also be the irregularities of the thyroid versus well-defined or rounded thyroid nodule. Now, as endocrinologists, we also take a look at the neck, that is the lymph nodes in the right and the left side of your neck, as well as around your thyroid, to see if we are noticing any abnormal lymph nodes, which could raise a suspicion for a thyroid cancer. What's the next best step once you've discovered a thyroid nodule on an ultrasound? Now, there are various characteristics which determine if a thyroid nodule is low suspicion versus moderate suspicion versus high suspicion, which helps us to decide as well as discuss with our patient that they would need to pursue with a fine needle aspiration. Now, fine needle aspiration is aspirating a tiny amount of thyroid, which is usually fluid, the cells, and are visualized under the microscope by the pathologist to determine if they see benign cells versus malignant cells versus various other atypical features, which helps us to differentiate if this is benign versus malignant. I'm sharing the link from American Thyroid Association for you to review regarding the various features on the pathology report of a fine needle aspiration of a thyroid nodule. What's the next best step once you've had the ultrasound done, or if you had a fine needle aspiration done and your nodule is benign? Now, next few steps are mostly monitoring. So depending on what the size and the characteristic of your thyroid nodule is, your radiologist or even your endocrinologist will discuss about a 3-monthly versus 6-monthly versus annual monitoring. And in certain occasions, if these are tiny millimeter cysts, then even 2 to 3 year interval monitoring has been suggested. But there are certain procedures like radiofrequency ablation or even surgical resection of thyroid nodule in case patients are symptomatic, or if their thyroid nodule cyst drained and there has been a recurrence of that cyst with a further enlargement. So the best thing is to get expertise, to get a thorough discussion with your endocrinologist about what your next steps are for your thyroid. In conclusion, thyroid nodules are common, but with the right knowledge and expertise, you can ensure your health remains a priority and your anxiety about these nodules has been alleviated with the right diagnostic steps. Follow along, like and subscribe to my YouTube channel, and share this resource with anyone who's dealing with thyroid nodule. I see patients throughout California, and if any one of you is interested, you can comment below, you can DM me, and I would be happy to help you with my expertise. Thank you for watching and stay healthy.